In the United States, almost 27,000 people have died from COVID-19, making it the country worst affected by the outbreak. But it's the words and actions of President Trump still dominating the headlines. He's been heavily criticised for halting funding for the World Health Organization. Here's how it started.
Today, I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there.
While world leaders, diplomats, doctors have criticised the announcement, this is what the World Health Organization itself had to say earlier.
This is a time for all of us to be united in our common struggle against a common threat, a dangerous enemy. When we're divided, the virus exploits the cracks between us. We're committed to serving the world's people and to accountability for the resources with which we're entrusted.
And this is the reaction from the editor of the Lancet Medical Journal.
Well, the World Health Organization's primary role is to defend the health of the world's population. And a crime against humanity is a systematic attempt to hurt the health and well-being of a population. President Trump has clearly committed that crime.
Well, as well as accusing the WHO of a cover-up, President Trump said it failed to adequately assess the outbreak when it first emerged in the city of Wuhan and accused it of trusting China too much.
The WHO willingly took China's assurances to face value, and they took it just at face value, and defended the actions of the Chinese government, even praising China for its so-called transparency. I don't think so.
Well, let's hear China's reaction to that.
The current global pandemic is grave. This is a critical moment. The US decision will weaken the WHO's ability to handle the pandemic and will undermine the international cooperation against COVID-19. All nations, including the United States, will suffer from the impact of the decision.
And Kerry Allen has been monitoring Chinese social media for us.
China and the US have had a very difficult relationship going back to early January when we were first hearing about this virus. And it was very much the case that, we were hearing Donald Trump calling this the Chinese virus, that Chinese media were wanting to give the impression that the US was not cooperating, it was pointing the finger. And so now that the US has suspended funding for the World Health Organization, this really increases this line in China. And people are very angry about this. They're seeing the US as not being cooperative, very much Donald Trump distancing himself from everything and wanting to point blame rather than helping other countries. And so now I'm seeing a lot of lines on social media platforms like Sina Weibo with people saying that he clearly doesn't care about other people's feelings and that there's a lot of anger towards him and a lot of concern for the US people.
And a bit of context here, the US has the highest number of cases and deaths worldwide, and there's been criticism of the federal government's handling of the crisis. So this is also political. A blame game ahead of this year's US presidential election. Well, let's bring in Anthony Zerka, who's in Washington. Hi, Anthony, good to see you. So it's always slightly uncomfortable talking about this through a political lens, isn't it? We had so many deaths there in the US, but this is an election issue.
It is, and that's simply the reality here. It's politicians who are handling this crisis, and so it's by nature going to be a political debate when it comes down to it. And as you mentioned, Donald Trump has been getting a lot of criticism for his handling of the U.S. response to this virus, downplaying its severity early on, whether he did enough in February to prepare various hospitals and healthcare systems to deal with the patients. And so now you've seen him attempt to shift some of this blame, most recently to the WHO, but he's also talked about China, about governors in the states not doing enough, or Democrats in Congress not coming up with a good enough legislative solution. So that's the reality. But if you look back, Donald Trump himself at one point was praising China's response for it, saying that they were being transparent. So the same thing he's accusing the WHO of right now, he actually engaged in similar type of language earlier on this year.
And viewers may remember, Anthony, that Donald Trump wanted to reopen the US by Easter. That deadline clearly has been and gone. Is there a timeline now?
Well, actually, what we're talking about right now is a May 1st deadline. That's what Donald Trump appears to want. That's what he's telling his administration officials to try to come up with. But the reality is it's going to be very difficult to open the whole nation on May 1st. The conditions in various states are very different. And the bottom line is that state governors are the ones who close things down. They are the ones who are going to have to decide when to open things up again. So that's why you're seeing various associations of states like California, Oregon, and Washington on the West Coast, New York, Pennsylvania, Connecticut, Massachusetts, and others on the East Coast trying to figure out the best way to do it. And they're looking at a step-by-step process where they can control the spread of the virus so they don't get some sort of a renewed peak in the spread and more deaths, more hospitalizations when they start to ease back on this restrictions. But I think all the politicians are looking at November, looking at the election, and they realize that they want the economy to try to rebound at some point soon.
Yeah, fascinating the power balances going on there. Anthony Zurcher, thank you very much for that. Right, let's assess the substance now of Donald Trump's criticism of the WHO. How valid is it? Well, I'm going to get some help here, thankfully, from a familiar face. There he is. Ros Atkins has been off Outside Source for the last few weeks, but he's joining us from his home to look into this side of the story. Good to see you again, Ros.
Yeah, good to see you, Lewis. Thanks very much. Yes, my family and I are going to be staying at home for a while, so it's good to be back on Outside Source, if not in the newsroom quite yet. And let's have a detailed look at the WHO and Donald Trump's criticism of it, starting with the World Health Organization itself. It's a UN agency, it's based in Geneva, and it has an annual budget of over $2.5 billion. Now that comes in part from member countries and in part from philanthropic donations. America's the largest donor. It pledges $400 million annually, though I should say it's in arrears on its contributions. The second largest contributor, well, that's the Bill and Melinda Gates Foundation. And there's now a sharp divide between these top two donors. We have Donald Trump saying US money is suspended because the WHO has worsened the outbreak with mismanagement and has covered for Chinese mistakes. And then we have Bill Gates. Well, he's been tweeting this, arguing that Mr. Trump's move is dangerous and adding that if the WHO's work is stopped, no other organisation can replace it. Now, clearly the two men don't agree here, but their analyses don't necessarily cancel each other out, as you might imagine, and here's why. It's certainly true that some of the WHO's statements have raised a few eyebrows. For example, in January, it said there was no evidence that COVID-19 could be transmitted from human to human, but it was already happening. Also, in late January, it declared a public health emergency but said severe travel restrictions were not necessary. Countries then introduced them all the same. It also said there was no need for all of us to wear face masks and then weeks later said it was reviewing that advice. We can also say it's true that the WHO has been effusive in its praise for China's response, and there's been no equivalent severity in its criticism of China's failure to speak publicly when it first knew of the virus, or of China's intimidation of doctors who did speak out. Now, critics say the WHO has been too soft on China for political reasons. The WHO says, look, it has to be diplomatic to get China to cooperate. It is also worth pointing out the WHO advises member states. It can't instruct them. The most crucial decisions taken during this crisis haven't been taken by the WHO, but by individual countries such as China and, of course, the US. There are a couple of additional issues here. The first is America's place on the international stage. This is a tweet we should take note of from the former US ambassador to the UN, Samantha Power. She served under President Obama. Here she is imagining President Putin thinking of Russia's efforts to help Donald Trump win the 2016 election and seeing this WHO decision. She suggests this latest decision is a destruction of US credibility beyond Mr. Putin's wildest dreams. But actually, this decision sits comfortably within Donald Trump's foreign policy. He's taken the US out of the Paris Climate Agreement, the Iran nuclear deal, a major free trade deal with Pacific nations, and its military commitments in northern Syria. The list is a long one. And we know he's suspicious of supranational bodies like the WHO, and he's suspicious of how much money that America pays, in his eyes, to sort out other people's problems. So this WHO decision is entirely in line with that thinking. So if we combine all of that with those political calculations ahead of the US election that, Lewis, you were discussing with Anthony Zerka, we start to get towards a better understanding of this announcement from the President.
Thanks so much for that, Roz. Important to dig into the nuance there. Fascinating stuff. Thanks very much.